Do you think the nursing profession has made progress in achieving diversity?
Yeah, I would say there's progress. There is progress actually, because we already have specializations, as we've mentioned. At least if you say, oh, mention specialties in nursing, someone will be able to tell you, oh, there's pediatrics, there's maternal child, there's oncology, there's geriatrics. But there's that sense of progress. But then in another sense, there's not really much progress. Why? Because it's just like being tailored down to the ones we know, and that's just it. People are not looking for means to evolve past what we already know. So there are other things out there. In fact, even becoming a nurse consultant, there are so many other things. If it's into education, if it's into being in the hospital, practicalizing it and everything, there are so many other things that people could do. So I believe there should still be more progress. Here at a point, but there is progress.
Yeah, slow and steady,
but then we need to be fast.
At a time.
We need to be fast.
Hi everyone, my name is Yeshua, your host, and as usual, I have something very beautiful for you today. With me today, I have a very wonderful guest, vibrant, eloquent, lots more, but we'll get into that in a few minutes. Today's topic is the importance of diversity in nursing. Hi, good afternoon. How are you doing?
Good afternoon. I'm fine, thank you.
Can you briefly introduce yourself for your nursing journey?
All right. So I'm Akingbile Grace, a registered nurse currently interning at Obafemi Awolowo University Teaching Hospital in Ile-Ife here. And about my nursing journey, I would say right from the time since I was a kid, I've always seen myself in the healthcare line. So not necessarily being a nurse, but in the healthcare line. But when getting into secondary school and university, I then knew that, oh, I wanted to be a nurse. Why? Because the whole care at the bedside, focusing on the patient and not necessarily the illness itself. That's how I knew I wanted to be a nurse. And I'm just grateful to God to where I am at the moment.
That's actually very beautiful, because taking care of people is a lot. It takes a lot of empathy. It takes a lot for you as a person.
Yes, of course.
Yeah, that's very beautiful. So now into the topic as diversity. What does diversity in nursing mean to you?
Okay, generally, I'll start from what diversity is, because diversity on its own is basically variations. I would say diversity in nursing then means a difference in like different fields, in specializations. It can also be in terms of cultural differences, demographic differences, but then we're talking about nursing, so we're talking about the specialties. And which ranges is a wide range. So probably from pediatrics, geriatrics, oncology, and just basically different specialties that are embedded in nursing.
Yeah, so these specialties have keynotes in the entirety of care as a nurse. So what do you think, why do you think it is important, this diversity in the nursing profession?
Okay, why diversity is important in nursing? It's important in nursing profession because, different people present to the hospital with different illnesses, different things that might be wrong. In fact, some people are actually even well and they come to the hospital. So having different specialties means there is that tailored care that a nurse has to give to that patient. It improves the patient's care actually. So you have maybe a person has cancer, or it's an old person even with cancer. There's a way you fuse geriatric nursing and oncology nursing, and they're able to tailor that care to that person. So there's a whole lot. Children, adults, the way you take care of them are so different. So having diversity in nursing is very, very important. It improves patient care a whole lot.
So like you said, it's very important because there are different cases, different individuals, and it takes a lot of study, a lot of time to
tailor down to that one person.
Yeah, that's actually a very key point to note down. What are some common types of diverse groups you think should be in nursing profession?
Common types of diverse groups. So I would say that based on specializations, there are already a range of specializations that are commonly known in nursing. For example, you have pediatrics, you have mental health nursing, oncology, as I've mentioned earlier, and lots more. But then there are other types that are not widely known or are not widely practiced, especially even in areas like ours, like in Nigeria. For example, I would say forensic nursing. I would say nursing research though it's known, it's not widely practiced as such. There's also we have nursing informatics, school health nursing, and lots more actually. So I think those are common types that should be included in the nursing profession.
Yeah, because I think forensic nursing is actually very important.
Yes.
And then nursing research it plays a key factor into how well we can evolve with the world.
The world is evolving. All of these things, especially those nursing informatics, forensic nursing, it's actually something that helps even with the way the world is evolving. Currently, I think they are doing it even in areas abroad, in certain countries. They're actually practicing it and trying to incorporate nursing into some of these. It helps a lot. So.
That's actually very beautiful. Mm-hmm. So, how does diverse nursing workforce impact patients' care and outcomes?
Okay. I've earlier said that it improves the patient care. So I would say it helps to give the right type of care to the patient at the right time. So, you're entering into a clinic, general outpatient, you're meeting a general nurse, they're asking you, oh, what and what, and then they direct you to the particular nurse who is going to help you out for your particular complaint. And, everybody just meets your needs tailored down to what you need. I mentioned earlier oncology. Okay, someone with cancer, they just direct you to an oncology nurse and you meet the person and it's just like, oh, this person gets me. Rather than sending a cancer patient to a maternal and child health nurse and it's not going to really bring out the best, even though they might have some general knowledge, but it's not going to be tailored down to exactly what is wrong with the patient. So it improves the right care.
The right care to the right
patient at the right time. Exactly.
That's actually great to know. Note. So, do you think the nursing profession has made progress in achieving diversity?
Yeah, I would say there's progress. There is progress actually, because we already have specializations, as we've mentioned. At least if you say, mention specialties in nursing, someone will be able to tell you, there's pediatrics, there's maternal child, there's oncology, there's geriatrics. But there's that sense of progress. But then in another sense, there's not really much progress. Why? Because it's just like being tailored down to the ones we know, and that's just it. People are not looking for means to evolve past what we already know. So there are other things out there. In fact, even becoming a nurse consultant, there are so many other things. If it's into education, if it's into being in the hospital, practicalizing it and everything, there are so many other things that people could do. So I believe there should still be more progress. Yeah, at a point, but there is progress.
Yeah, slow and steady,
but then we need to be fast.
We need to be fast. Definitely. So to you out there listening, whatever you feel like you have a drive for, you have a vision for, go out, pursue it, run after it.
Exactly.
Definitely you can achieve it. So now, moving from that aspect, every step would have some challenges, would have some difficulties.
Yeah.
So what do you think are the challenges to achieving diversity in nursing, especially in Nigeria?
Okay, tailored down to Nigeria. The lack of resources, I don't think to a wide extent, I'm not sure, but I don't think the government out there is ready to assist to the very detailed level. I don't think they're ready to assist to that very detailed level. But so just lack of resources, lack of information, lack of exposure to these things. I mentioned less traditional parts of nursing. So if there are more information, if there's more awareness and people are able to know that, I can actually go into this thing and I have passion in it, then I believe they will be able to enter into those specialties. So it's just lack of resources, lack of time, of information, access, lack of information. And all
so we need to work on getting more resources, more information,
exactly, more awareness,
for people to know things that they can go into, things that they can diversify as a nurse. So we just go on a quick break and we'll be back. So, as a student nurse, we always have issues getting proper resources and information. And this is what Nursing with Light offers. At nursingwithlight.com, you get proper information and resources to help you navigate through nursing school, whether from pharmacology to med surg to community health. And this gives you direct questions on each topic to help you practice. Now, aside that, there's the fun part of Nursing with Light. At their Instagram, nursing_with_light, you get various diverse, relatable content as a nurse and also as a nursing student. This helps you just ease and take care of yourself while you study as well. Now, Nursing with Light is a very beautiful and dynamic page to get yourself the right type of information and also have fun. So take some time to check out Nursing with Light. Thank you. Welcome back. I will just go straight into it. So, as we're talking, we're talking about diversity and diversity tailored into specialty,
Yes.
not based off gender or ethnicity, but into the specialties that you can focus on as a nurse or as a student nurse.
Yes.
So now, if you could implement one change to improve diversity in nursing today, what would it be?
I like that. If I could, I would. But then I would say at different levels, there are different things you could do. So currently, I'm interning, and my posting currently is in community health. And I know I was having a conversation with a nurse about how in the family planning section, yes, in the family planning center, why is it that there are not patients with disabilities coming to seek for family planning and all of that? So, and I brought up the suggestion that, I think we should conduct a research and all of that, be able to seek out these people and know how we could get them to come, maybe providing the means and all of that. So implementing or how I could foster a change in the whole diversity and specialty stuff. I think just creating more awareness wherever I am, just creating that awareness. And if I get to the point, when I get to the point, where I could create it nationwide, because yes, we're going places. When I get to the point where I'll create it nationwide, where I'll be able to, then I'd like to just spread that awareness. And if it's even to offer scholarships or just ways people will be able to get into this education and discover themselves, their passions and talents, then
this is actually very beautiful because it's one thing to notice a problem and it's one thing to be determined to make a change or solve that problem. So very beautiful. We know that people with disabilities, people with different health issues, people that need knowledge. That's still
diversity,
help.
Basically. So cultural diversity, so their own diversity.
Definitely. So we're just looking for how to better the care of humanity in general. That is what we do.
And that's what nursing is all about. So yes.
So this is outside the whole diversity. I think we've had a very wonderful conversation about diversity in nursing and how people can get resources and information and just dive into the ocean of knowledge that nursing has to offer. So now, aside that, who's your favorite nursing content creator or favorite nurse and probably favorite nursing student as well?
Okay, favorite nursing content creator, favorite nursery student. As for the content creators, permit me to say, but I'm going to say Nurse Jen. I'll start with their whole list. Actually, I don't think I can pick out a favorite, but there are people who I watch and just gives me joy. So sometimes when I'm looking for time to take a break from the whole stress of nursing, I go to watch Nurse John because it brings out, it just shows that whole part. There's Nursing with Light. There's this white nurse I do watch, Alexis Nicole, and all of that. There's just so many. As for favorite nurse, I'll say I've met a lot of great people like throughout my time, even my time as a student, my time as a volunteer nurse, my time in internship, like all around. I've met a lot of great nurses. I don't really know if I can pick out a favorite, but I'm going to bias here and just say, okay, my grand aunt, because she's family. So yes, my grand aunt. As a favorite nursing student, I wouldn't say I have a favorite because even the people I could have chosen as favorites, they must have graduated by now or all of that. So, but every student I come across that is willing to learn and willing to actually make an impact, I would say I'll consider them favorites. So yes. Yeah.
So, for our listeners out there, she's giving us wonderful knowledge about diversity in nursing and different things. So now we're going to ask her questions. We're going to ask you some questions, and don't worry, there's cash prize to win, but the more you lose, the more you lose the funds. So let's say you have 30 points, and for each question you lose, you're taking out of your points, and that will determine what you get to go home with. Are you ready? Let's hear it.
Not really. Okay, I am. Yes.
So, question 1. What is the primary purpose of taking vital signs?
Okay, good.
A, to diagnose diseases.
Okay, we have options, all right.
B, to monitor a patient's progress. C, to administer a medication. D, to perform surgery.
Every day.
B, to monitor patients' progress.
Yes, monitor their
Final
progress.
answer.
Yes.
Final answer.
What was A?
And you are correct. This is actually
Final
correct.
answer.
You're doubting yourself.
No.
I should have even allowed you to change your mind.
No, it's B. I had to observe baseline data or to monitor their progress.
Definitely. Question 2. What is the main purpose of heparin? A, to lower blood pressure. B, to control pain, sorry. C, to prevent blood clotting. D, to treat infection.
C.
I'm not going to ask you.
know
I'm
it
not going
now.
to ask the final answer again.
But then it's correct. It has to be
That's the correct answer.
Yeah.
That's the correct answer.
So,
Question 3. What ancient civilization built the Great Pyramids of Gaza?
oh no. I don't even know. What's the pyramids of Gaza?
A, Egyptians. B, Greeks. C, Romans. D, Mesopotamians. What ancient civilization built the Great Pyramids of Gaza? Egyptians, Greeks, Romans, Mesopotamians.
I'm still confused between A and D, and I'm not even sure if anyone is correct.
Don't worry, don't worry.
Okay.
You want to phone a friend 50-50, you know?
A.
Final answer.
A.
If you had chosen C, you would have been wrong. If you had chosen D, you would have been wrong.
You give me
answer
my
is
confidence.
I'm bringing out my inner Frank. Frank, it's not Frank at all. It's not him. Yeah, for
Is
what's
it though?
been.
Is it though?
Then I think I'll do really well in that show.
Actually, you're giving me. Oh my god.
For your
that's
final
like
question to go home with.
Okay.
Let me not just so that they will not carry you as they are going out. Let me not see the amount.
Yes.
Let me just
Because
carry
I have
it.
faith in you, so I know that.
Definitely.
Okay.
So for the final question, for you to go home with, you know,
We're not mentioning. We're not saying.
let's just keep it private.
But okay.
What technique is used to access long sound? A, percussion. B, palpation. C, auscultation. D, inspection. I'm done with the question.
I don't know. I don't know, in case you want to add more,
No,
just in
I'm not
case.
using it.
I could have answered that without waiting for the options, you know.
Yeah,
I mean,
definitely,
nurses are smart.
definitely,
But then the answer is, you know, if I picked A.
Just tell me your answer. Tell me your answer. I'm not asking the question.
Auscultation. So that's C, I believe.
Is that your final answer?
Yes.
That's actually correct. So we've had a wonderful time, and
Yes, of course.
with you winning, you know, congratulations on winning.
Thank you. My gift.
Yeah, definitely.
We must not forget it.
So
Okay.
we've had a wonderful time. We've talked about diversity in nursing. We've talked about different things that you would love to get information about. And you know, as usual, this is a fun place for people of diverse professions, whether you're a nurse, whether you are a tech pro, a tech sis. You understand the beauty of
Collaboration.
and nursing as a whole. So I remain Nathan Yeshua. This is a wonderful guest I had today. It was very nice having you in the studio.
Oh, it's nice being here.
We are shooting live at NCI Studios, and it's fully curated for all your content needs. Don't forget to like, share, and subscribe. And you know, take some time to find out more about nursing as a whole. And I'll catch you on the next episode. Thank you.